Perfect. So welcome everyone. My name's Summer. I'm the Senior Administrator for Lancashire and South Cumbria Training Hub, and I'm here today with Corrie.
So hi, I'm Corrie Llewellyn. I'm the Clinical Quality Assurance Lead for the Lancashire South Cumbria Training Hub, and I'm also Advanced Nurse Practice in a small practice in Penwitham.
Perfect. So yeah, we're Lancashire and South Cumbria Training Hub. We're the primary care training hub powered by Morecambe Bay Primary Care Collaborative, and we're part of the Northwest Primary Care Training Hub. So you've probably heard of a couple of other ones in the local area outside Lancashire and South Cumbria. So we're one part of the full of the Northwest training hubs. And then within our training hub, we've got each locality as well. So you're probably all a part of each locality, or you may know us through another dimension as well. We're sort of keeping it quite interactive today. Don't feel like you need to be involved. If you sat there eating your lunch, that's fine. You can keep yourself on mute and just have us running in the background, but we do welcome you to introduce yourself. So if you want to, you can just pop your name and job title in the chat box, just so we have a bit of a rough idea of what audience is listening into today. So yeah, today we're going to be covering the support for the NHS people, the health and wellbeing offers from the NHS to their staff. So now more than ever, especially, there's been lots of different new things going on over the past year that we haven't been used to. Normally there's a lot of remote working, there's a lot of changes within practice as well. So the NHS is really focusing on the range of guides, apps and events to support the wellbeing of all the teams within the NHS, so all the staff members. There's a big package of emotional, psychological and practical support. And every slide that we come across today, so everything that we go in depth in, will be on the website, which is www.england.nhs.uk/people. So if you do miss anything, that if we're running a bit too fast or anything, do please ask us a question as we go along. But you can go to that website. Everything is accessed on that website, and we'll repeat it at the end of the website. So if you haven't got time to write that down, it will be repeated at the end, as well as our website as well. So all the links, everything will be completely accessible after this session.
Okay, so we'll go into a bit of the support that's being offered at the moment, and just if you want to put in if anybody's accessed any of the support at the moment or have done in the last couple of months, if you can pop it in the chat box and tell us if it's been useful, what you've used, that'll be really helpful. So help now. So there's a staff support line for us. You've got a confidential staff support line operated by the Samaritans, and I think we all know who the Samaritans are. Obviously a national organisation. So you've got free access from that from 7 AM till 11 PM, 7 days a week. And it's there to help you when you're feeling that you've had a tough day, you're worried, you're a bit overwhelmed. Even if you're just feeling a bit lonely and isolated and you want somebody to talk to about anything, feel free to use it. So you can call that number on 0800 069 6222, or you can text it, and you can text Frontline to 85258 for support 24/7 via a text. Okay, so there's a website there, but I won't go through the website, but you can always put it on the chat. I'll send you the slides if you feel you need them. So there's also a bereavement support line. So we've got a confidential bereavement support line operated by Hospice UK. They're also a national programme. It's free access from 8 till 8, 7 days a week. A team of fully qualified and trained bereavement specialists are there to support you. Any wellbeing issues related to loss that you're experiencing through your work, you can give them a call. The telephone number is 0300 303 4434. And then, of course, there's a bereavement and trauma support line for Filipino colleagues as well. And that's a fully qualified, supported professional speaking, ready to help you for any assistance that you need. From anywhere in the country, you can just contact them. The calls are treated with the strictest of confidence, and they'll be explained when you get the call. And the service is 7 days a week between 8 and 8. You don't need a referral, so to just book a consultation, you can give them a call on that number that you can see on there, and we can send you the slides so that you don't lose the information afterwards. We have got a brochure on it.
Brilliant, thanks, Corrie. I can see a couple more people have joined just in the middle of the, past the beginning of the session. Just to let you all know, we are recording this session. You're very welcome to keep your cameras on, and you're very welcome to, you know, put your hand up, ask questions, but we are using the chat box as well. So just to let you know, we are in the middle of a recording for your permission on this. So yeah, moving on to the virtual staff common rooms. Now, a couple of these slides, they may be useful to you, they may be useful to people you know within the NHS. So we are covering all of the offers that are on at the moment. They are in development as well. So currently the virtual staff common rooms, they were a bit of a trial and they've been paused at the moment, but they are in conversation still. So within partnership with the NHS Practitioner Health, they developed these virtual staff common rooms for colleagues across the NHS and the ambulance sector. And within those sessions, they were just a chance to reflect, share frustrations and experiences, and find a way to cope with COVID-19 and how it affected home and work life, because we know it has all changed a lot of people's home life as well as work life, whether it means you're suddenly working from home. There was a lot of people doing, well, we all know within primary care, a lot of people were doing a lot of overtime to help out as much as they can. There was a clear peak within COVID-19 where there was a lot of pressure within primary care, especially with the vaccination programme rolling out as well. So these common rooms were really needed at that peak time. I think they're just in conversations at the moment, you know, in terms of can we resume it and how useful will it be over the next couple of weeks or months. So we will keep you updated in terms of on our weekly updates we send out within primary care and on our websites as well if these do resume. But as I said, it will all be on that People website as well when they do resume, if they do. So as well as that, there's lots of online support that the NHS hosts as well. So there's counselling support as well, which is a free service developed and funded by the Association of Christian Counsellors. And they're offering up to 10 online or telephone counselling sessions, which is amazing. I mean, I don't know if anyone else feels the same, but whenever I'm online or anything, there's constantly adverts popping up online when, you know, if I'm on YouTube or even watching things on TV, there's always adverts about online counselling support. And I think that is a target at the moment. It's what people are looking for when they're searching for things online, and especially with the remote world, people feeling a bit isolated. It's just someone to talk to who's not just a friend or a family member. Sometimes there are personal things you do want that one-to-one connection with a completely strange professional. So people within working in the NHS who are directly impacted by COVID-19, people working within residential care homes who've been impacted or by caring for those with COVID-19, and anyone who has been bereaved during this time as well, that service is available to them. It's open to people of all beliefs as well, and you can be matched on your ethnicity as well. So there is more information on that on the People website as well, but we'll give you all those links right at the end. Okay, so the NHS has partnered with project5.org to make free one-to-one confidential support sessions available for anyone in the NHS. So the project5.org is an online booking system which gives the NHS staff free access to one-to-one support from a team of accredited clinical psychologists and mental health experts. It's a wellbeing support service. They're there to help if you need them, and it's really useful that you make that if you feel that you're struggling. You can see that there is the website. I won't go through the website that's there at the bottom, but obviously we'll share the slides following. Okay, so also I think probably everybody's heard of Relate. They are a national organisation for relationships. So they are a massive charity across the nation, and they're offering support to the NHS staff. There have been Midlands and London have piloted it, and there's been 30-minute web chats or phone calls with relationship and wellbeing advisors. They're recognising the extraordinary circumstances that the NHS have been working in as a result of the COVID-19. They've launched a Relate Hub, which is a safe and confidential place where any relationship issues or wellbeing concerns can be discussed and worked through. They can help with problems with partners, children, family, friends and colleagues, health or job worries, stress at work or other anxieties, feeling isolated, loneliness, and oftentimes to just look at your own wellbeing and see how you're doing and checking in. The relationship and wellbeing advisors will help people put a plan in place to tackle their own issues or signpost to further advice if needed. This is really useful.
It's not only been at work that people have been subject to different stresses and strains throughout the COVID, but also all of the time as well. So you can access this at the moment. It's a really useful tool, and that number is 0300 303 4477.
So moving on to wellbeing apps, which I'm sure a lot of people listening in today are going to be very interested in. I mean, the counselling and online support, that is all brilliant as well. And there may be some people who are listening in today that really want to focus on those lines and, oh, they're brilliant, I don't need to have a Google and find out what's free and what's not. That's probably been a good resource for you to find out exactly what you need in terms of calling people and finding that support, or whether you can share it within family and friends, because I know a lot of these resources are for the NHS, but there are free resources within there externally as well, or you may be able to share it with colleagues within your practice or your workplace. Now, the wellbeing apps, I know we're not meant to be biased, but they're kind of my favourite sort of area within the NHS office. I'm very much, on my phone a lot. I use my phone for work, I use my phone for home life, and I think the way that the world is going, people are using apps a lot more. It's just so readily available. So at the beginning of the wellbeing offers that were released, there were a couple more apps that were available, but we're only sort of talking about the ones that are currently available now. Just because there was a bit of piloting process of, we'll extend some of these until the 31st of March and see how they go. I think if you did sign up before the 31st of March, they are still available to the people that signed up, but these are the 4 really that are working with the NHS and are highly recommended. There are other recommended apps, and you'll be able to find those online. You may know them externally through friends who have sort of said to you, "Oh, try this one out." And there are other recommended apps out there, but these are the ones the NHS are really focusing on at the moment. So Unmind is a mental health platform that empowers staff to proactively improve their mental well-being. It includes digital programs designed to help with stress, sleep, coping, connection, fulfillment and nutrition, which is a huge amount of lots of different things within one app, really. I know there's different apps you can use externally to track, your fitness, track your the way you eat and stuff like that. This is a nice sort of overall well-being app that is available. Also, Headspace, not meant to be biased, but this is the one I use every morning and every night. And before I started using this, I would have never really thought to use any of this, and I thought I will give it a try. And this was after when myself and Corrie did the podcast on the health and wellbeing, which you can see and we'll talk about at the end of today's session. I thought, I'll try that Headspace, because one of my friends who doesn't work within the NHS, she said, just try it, it'll help you get to sleep at night. There's loads of mindfulness and meditation things within the app. It's got tools and resources to reduce stress, build resilience. There's a section on there with music, to help with your concentration. The main one I use it for is these sleep walkthrough sort of meditations, and it's basically somebody just talking in a calm voice, telling you a story. And I'm never one of those people that could get to sleep within 7 minutes, but I did get to sleep within 7 minutes every night with this playing. And there's wake up things, there's sort of documentaries you can sort of listen to and learn new things every day, and it just gives you that break from your daily life, whether it's work or home life. So I do really recommend that one, and that is still available until the 31st of December. So you've only got until then to sign up through the NHS. They may extend it. But that is from my personal advice. I would highly recommend just giving that one a try.
Okay, so a bit more serious talk now. So there is a really good wellbeing app called Stay Alive. The Stay Alive app is a suicide prevention resource for the UK. It's got really useful information and tools for you to stay safe in a crisis. You can use it if you're having thoughts of suicide, or if you're concerned about someone else who may be considering suicide. It is a really useful app. I recommend you can download it onto your phone or anywhere else. Have a good look at it. It's really useful, just even as a practitioner, to have and have a bit of information to give you a bit of guidance if you feel that you've got patients that you're aware of, or you just need to learn a little bit more about the suicide prevention. It is there. It's very handy. I've got it downloaded on my phone and I found it really useful. So you've got Bright Sky as well, which is a free download to mobile app providing support and information who may be in an abusive relationship or those concerned about it equates, and it's available to use in Polish and Punjabi and Urdu, and I think that's a really good, useful tool. Domestic violence, domestic abuse has skyrocketed during the COVID and everybody being in lockdown. And I think the service that this is offering for the app is really informative. And maybe if you're concerned about something like, but they don't want to download it on their phone for safety reasons, you can show it them on yours, and it's really good. Okay, so city parents. So we all know how everyone has struggled during the time that schools have been closed, or you've got young children and you're trying to work from home if you're working remotely. This wellbeing app is called City Parents, and it's really useful for any parent that's struggling a little bit. It gives you loads of positive and practical support for working parents. Just a bit of handy tips. Sometimes when children are fed up and they're not necessarily being naughty, but you kind of need to get them to be doing something else while you're concentrating on your work. Well, this has got loads of information and articles, blogs and podcasts and advice from other people struggling in the same sort of situation as well. It's aimed at working parents. It helps you develop your skills and enhance family life and improve well-being and support the work-life balance. I think there's some creative stuff on there for the children. It's a really useful app to have.
Yeah, so a lot of these apps you may have heard of before externally to work. There are free versions, but these are the apps that the NHS is working with. So, for example, the Headspace one that I was talking about, I know for a fact that there is the premium version, and that is what the NHS is offering to you if you do sign up with your NHS login or your work email address. So all these apps, if you use your work email address, you will have access to more parts of the app, the premium access that you wouldn't normally have usually. Now moving on to more of the wellbeing resources. I know money can be quite a stressful topic, whether it's something you're thinking about alone or you're speaking with somebody at home about. It can be, we all rely on quite a lot of our financial sort of wellbeing and health, and there are a lot of people with financial concerns. So the NHS does recognise that it is a difficult time for their people, and they know that financial concerns have consistently been one of the top 5 reasons that people call the free support helpline by the Samaritans. So the NHS has partnered with the Money and Pensions Service, which you've probably heard of before. They're quite well known, and they'll bring financial wellbeing support to help you manage your finances at home. So whether during lockdown, if that has affected you at all, if it's an ongoing thing that you've been struggling with or thinking about, or somebody has sort of come to you and said, look, this is something I've been really stressed about, it's leading to a lot of my anxiety recently, you could even recommend this to them as well. So they have online financial wellbeing events, or you can visit their guidance and tools for support, and that'll all be on the website that we'll discuss at the end. So that's a really useful, when we think about health and well-being, we don't always think about what is causing those health and well-being issues, whether it's you going on one of those apps or looking within the guidance and support and you realize that's what's at the bottom of causing my stress and anxiety. But this, we don't normally talk about money and think, oh, it's the financial side. There is health and well-being on the financial side, really. So yeah, go in and have a look at that support. That's really great that the NHS is offering that.
So I'm just going to say, Summer, because I had a look at this financial health and wellbeing support just for information, and I obviously am in a really fortunate position where I don't have any financial worries. But you know what? It actually helped me realise how much money I was spending and wasting on doing certain things that I didn't need to be doing. And I downloaded some of the budget planning, and it was really good. I managed to save my bit so I can do a bit more on my garden, which is really good.
Yeah. I mean, over lockdown, whether it's just lockdown or long term, money fluctuates. Financial health fluctuates within every person throughout their whole life. And I was speaking to a car dealership a couple of weeks ago, and they said, do you know, people have really done well saving over lockdown. He says that as a general, comment, because probably people are coming to him to buy cars. But, it's affected people in different ways, whether you've suddenly realised, oh, I'm not spending as much money going to the shops and going here and going there. It's, should I be saving that, or should I be putting that in a different, will that affect me long term? Or whether it's, had the opposite effect, and I'm spending a lot of money on things that I wouldn't have spent before all of this. So yeah, having a moment and thinking about and going on all these tools and actually realizing, oh, I've spent my money in the wrong places there, and that's why I'm a bit stressed out about it. So yeah, it's brilliant to hear your sort of personal approach there, Corrie, as well.
So another wellbeing resource is Places to Be. Now, this is really good because it comes at from a different angle, really. They've offered online support programme of expert support and resources for key workers, including all NHS colleagues, to support mental health and wellbeing of the key workers and their children. And I think as a mum, I've noticed the children have really been affected by COVID and being off school, sometimes just not sleeping as well as they could do. Just having that resource there to be able to look through it, to be able to show what you can do, easy tips, information from experts has been really useful. So the programme consists of 3 webinars and an art room resource pack for children and parents for crafts and creating. It covers recovery and self-care, understanding and managing anxiety, and understanding loss and bereavement. And that's really useful because it gives you a tool that you can use not only with related to work, but you can use it at home as well. I know that I've used some of the resources to go through. It's okay that they've been a bit more anxious to go out, or crowds and things if they've been quiet and quite isolated. I know my son, who's 10, he definitely found it more daunting when there was more people with more masks and there was more people about, and it was just like, it's okay, that's normal for you to be like that. And just getting that information and getting the resource from experts has been really useful for us to utilise.
Yeah, definitely. I mean, especially we hope that lockdown is sort of easing, especially for the children and, you know, going back to school and everything, but there are still those restrictions in place that weren't there before. And there's a lot of children who are sort of entering a new environment, whether it is a big change going from primary school to secondary school, but especially with all these strict restrictions put in place, it just puts that pressure a bit more further on. You know, how do we keep our distance, and why is that person backing away from me when I run towards them? It's hard to understand for kids. So having that sort of place to read up about children's mental health and read up what is everyone else experiencing, is it just me, and the art room, the resource packs, just providing that stimulus for those times that you do need to stay at home. Yeah, I think that really helps. So moving on to further wellbeing resources, substance misuse and gambling support. I think there is a sort of a part of this that people just don't like to talk about. I don't know, so there's some people that just may find this, I don't want to talk about this with family or friends, I don't want anyone to know about this. It may be someone that they know and they haven't really spoken out loud, but they've hinted and thought, actually somebody I know is actually really struggling with this. So recognising the increasing pressures on NHS staff, they've put together a range of information on substance misuse and gambling support. And there's a number of organisations on the People website, on england.nhs.uk/people. There's different organisations you can go to, and obviously substance misuse and gambling covers lots of different areas. So it's good to just understand what those actually mean, whether it's a patient you're dealing with, or a colleague, or a family member, or a friend, or yourself, and who is affected by this. So substance abuse or misuse can severely affect a person's physical and mental health. It can impair their ability to function, and equally cause them harm to others and to them and others around them. There are a range of services and helplines that can provide support to those who may need somebody to talk to, just to talk it out, understand, you know, because people just don't realise when it is affecting them themselves. Sometimes you just have no idea because you don't know what it is. Gambling as well, problem gambling can have a devastating impact on individuals and their families in all areas of life, including relationships, physical and psychological health and well-being, work and self-esteem. And there is help available, not only, like I said, for the gamblers themselves, but also their friends and family, because even if it is the individual that is suffering, friends and family around them are, you know, trying to help them. It affects them as well, and their health and well-being and their thoughts around it. So yeah, we will leave the last slide on so you can find all the links and write them all down, but there'll be more sort of, and they get updated all the time, so there'll be helplines and different areas that you can go to depending on the specific situation.
Okay, so one of the wellbeing resources is health and wellbeing guides. Now these are on the website always, not just COVID related resources, but they are there to be utilised all of the time. So health and wellbeing guides, they're 20 short guides to help support you with skills and new ways to improve your experience of work. They cover such as getting a good night's sleep, personal resilience, support for line managers, guidance on how to be a compassionate leader during a bereavement, and tips on how to run your own 10-minute pause space. Now, if you don't do anything else from this meeting, if you try this, they are absolutely excellent. I had went on one of the 10-minute guide spaces, and actually, because I mean, I'm working from home now for most parts, but just that space that you normally would have on your drive home, or with your ability to be able to pick your children up from school, and we're not doing that. It's that space that you normally would have had in a day-to-day. And we were talking about this the other day. Me and normally, if we were working in the office, we'd be going for a tea break or a coffee and a bit of a chat. You sort of say hello to your colleague. And we haven't been doing that because we've been working from home. We haven't really had those 5-minute snatches of normality and chat spaces. But these guides and these pause spaces are really useful to just download, to utilise them on a daily basis. Even the fact that when I used to see patients back to back, it was the time when they'd left the room and I was going to wash my hands, and actually having that space to just think before I spoke to anybody else. I found this really useful. But there are some really good pause spaces on this, and I really would recommend that if you don't do anything else, you have a look at this.
Yeah, exactly. I mean, yeah, that's something we spoke about on a Teams meeting, didn't we, Corey? I sort of said we've been organising in our team, which will lead on to support for leaders on the next slide. But you know, we've been having weekly catch-ups just to make sure we are checking in with everyone. And whether you might not be a remote team, you might be a team that you do work all together, but you may have experienced throughout the pandemic that suddenly you haven't been speaking to that usual person when you've been making that cup of tea in the morning, or when you come in and put your coat up and put your bag down, you haven't really had that passing comment say, oh, hello, how's your weekend been, or anything like that, because you've been that busy. So it's taking that time out and thinking, oh, in that break time, or maybe not at lunchtime in your own time, but maybe in between appointments or in between meetings and schedules, actually I'll just go and have a chat with that person. And that's a major part of mental health and well-being, just to make sure you are touching base with your team as well and being connected still. And these resources will sort of give you a bit of a guide on how to approach that in the new sort of working world. So oh, Nicola, I did see your comment there about sharing the slides. We will be able to share them at the end. Just to let you know, they may change over time. These are the current slides, so we will put the version and the date that they are on, because obviously, like we said throughout the session, the NHS support offers will change, because some have been paused, some of them will be moving as we go along. There may be more offers being put on, but we will pop them on our website, and I'll put our website link in the chat right at the end, so you can have a look at all the resources. And we've been hosting a podcast recently as well to coincide with this event. So yeah, you'll be able to access them all, don't worry, and get onto all the links and see, because I know within this slide specifically, it does say there the exact link to get to the how-to guides. So we'll share all these slides at the end. So moving on to support for leaders, it's nothing, we didn't really cover this sort of throughout the session, but it mainly because all the resources that we are talking about is for every team member as well as team leaders. But whether you are a team leader yourself, a manager, a practice manager, you know, a line manager, if you have someone that is working and reports to you, it is really important to know what's available from the NHS. So whether it's something that you are just passionate about yourself, or you want to know about these resources for your own self or for a colleague, or if you are managing a team, it is really important to be sharing these resources and letting your team know, because we all know there's lots of different development you know, presets within a team, and make sure they're developing and know their career path and that. But also health and well-being is a massive part for retention in your employment, and for making sure that your team's happy as well, and it creates a happier team and a nicer place to work, really, and you produce better work at the end of the day when everyone's happy. So support for leaders, it includes one-to-one coaching and mentoring support sessions, and there are leadership support circles, and there are 10 evidence-based behaviours for leading through COVID-19 and beyond. So there's specific focuses on COVID-19, and there is sort of coaching and mentoring, which is amazing. I know in other companies and external to the NHS, not every company has this sort of support there for leaders. So it's great to sort of develop yourself as well. And then for executive leaders, there is leadership stories and reflections, one-to-one psychological support, chief executive common rooms, and virtual action learning sets. So it's nice to have that one-to-one coaching. You know, if you weren't working within the NHS and you owned your own company, it would be very expensive to have one-to-one coaching sessions as a leader. So really do make use of that if you do have, even if you have somebody, you know, working under you and reporting to you. Develop yourself, because I know we all think of our career path at the end of the day as well, and where you'll be moving to, and having that one-to-one support, speaking about what you struggle with, what you want to improve on, what you're doing well. Yeah, do have a look on there as well.
Just going on from that other slide, I mean, the other thing is to remember is that if you have got a leader, or you've got a boss that you want to you think could utilize this and they don't know about it, pass it on, because a happy boss is means a happy team. So it's really good to have that that they get the support as well. So I know we've talked about a lot about all the staff in the NHS, but specifically for staff in social care, colleagues working in health and social care can access this support, and it's developed by the Department of Health and Social Care, specific for social care staff. So the support lines for them, there's mental health apps, there's a bespoke online platform, which you can see the website is up there. But this is really important because all those working in regulated care or the voluntary sectors and in the social care sector obviously need a bit of support as well. So ensuring that they know about this, passing this on. If you know any colleagues, I would certainly recommend that they get access to this too, because they're just as important as everybody else. And I would recommend you pass it on if the care homes that you know don't know about it, pass the info on. And this is really good. So I'm going to talk about this, and it'll probably be a bit enthusiastic, but I really like this. So I'm very up on mental health awareness, and I think it's really important that as nurses, talking about myself as a nurse, really have a mental health awareness, not only for myself, but for patients, for others as well. And this local mental health resilience hub that's been set up in all the areas is absolutely fantastic resource. It's got NHS staff mental health and wellbeing hubs, and they've been set up to provide rapid access to local evidence-based mental health services and support where needed. So on this website, you can see which support resources are available in your area. It's really handy, it's really useful. Even if you don't utilise it for yourself, you've got the resources there to use with patients. The hubs are confidential and free of charge for healthcare staff. And if you access them, you can actually get a clinical assessment and support referral, and the support that you need for yourself, such as a talking therapy or counselling if you think you need it. I think it's a lovely website. If you go on it, have a look. They've got a lovely rainbow as part of their resilience hub as their logo, and I think it's a really useful tool. It's got all the resources on there. I would totally recommend you going on and having a look at it. It's really good, and the more people that use it and share it, the more we'll get to keep it.
Great, thanks, Corrie. Your phone's probably vibrating because I'm talking in the chat to everybody today.
It is, sorry.
So yeah, I would just thought I'd pop in there before we go on to useful links. We'll upload today's PowerPoint onto our website under the Health and Wellbeing resources, which I've just put the link in there, and also today's recorded session will be linked in there as well. Now, under the Health and Wellbeing resources on our website, there is a little section for the podcast, which basically has a lot of the links from today's PowerPoint. The podcast is a bit more accessible if you just haven't got time to sit on this webinar. There may be people within your surgery or within your workplace that really wanted to come to this webinar and said, oh, can you send me any notes over? It might just be easier for them to listen to the podcast in the car on the way to work, on the train, when they're commuting, or when they're doing the dishes in the evening or something like that. I listen to podcasts all the time, not always health and wellbeing ones, but podcasts are sort of becoming the new thing for a lot of people when they are busy doing things and they can't visually be looking at things all the time. So the podcast does cover a lot of what we've been talking about today, and a lot of resources are on there, but also on the health and wellbeing page we'll pop all the stuff on there as well that we've been talking about. So some other useful links as well. Better Health, that's healthy changes start with little changes. whether you want to lose weight, get active, or quit smoking. There's lots of free tools and support there, which I'm probably going to have a bit more of a look into myself as well. Everyone has different sort of goals and targets. Every Mind Matters, that's probably another one you've heard of as well. There's expert advice and practical tips to help you look after your mental health and well-being on there. Live Well, there's advice and tips and tools to help you make the best choice about your health and well-being. The National Health and Wellbeing Support for the NHS people, that is pretty much everything we've gone into depth on today. So that is the link there that you'll need. That'll be on our website and obviously within the PowerPoint when we share it online. So everything we've gone into depth in today you can find on that website, which is www.england.nhs.uk/people. The National NHS Mental Health and Wellbeing Support options. So if you're feeling stressed, anxious or depressed, or if you want to feel happier, the NHS website can help signpost you to some existing support options as well. So there has been some long-term sort of support options that the NHS have been sort of hosting for quite a while, and these ones that we've covered today are sort of the new ones that they've been focusing on as well. And obviously the NHS app library, which will be all those apps we discussed today, and probably some more that they're going to bring in hopefully to help manage your health and well-being. They're my favourites. We're not meant to have favourites, but I'm an app person. I love my apps. And then in the bottom there is our Training Hub website, which is that I've also put in the chat box, which is www.lscthub.co.uk. You'll find the health and wellbeing pages on there. You can also find out all the other stuff that we do within the Training Hub, working with primary care as well, and probably find out a bit more about us as well. But yeah, if anyone has any questions, let us know. Do you have anything to add there, Corrie?
Yeah, so one of the things that I'm going to add is, and it's not been shown in these slides today, but a brand new hot off the press. The NHS are working with the Invictus Games and helping introduce like the Couch to 5K. That's on the website, and that's really interesting. Getting a bit more active and helping us get out more, especially now the weather's getting a little bit better. Fingers crossed it's not going to change slightly, but that's really useful and it's there to access as well. And I know we haven't shown a slide on it, but obviously that's new. One of the other things that we're doing as a Northwest Training Hubs, we've commissioned the Charlie Waller Memorial Trust, who are a charity set up in the honour of Charlie Waller for supporting mental health and mental health awareness across. So they're doing 6 podcasts for us, and we're going to be releasing them over the next 6 months. And they are going to be on different things. We've got one on resilience, we've got one on wellbeing, and they'll be easy to download and accessible for you. And they'll be put on the website, and we'll cascade them out through Teams and everything. And they're going to be really useful. But we're also going to be reproducing several webinars over the next couple of months as well for health and wellbeing. We've got one on wellbeing coming up, and we're going to have a few more on mental health awareness, common mental health conditions and things that you can access that are useful for staff in primary care as well.
Yeah.
And anything, if you can think of anything that you would be really useful, that you think would be helpful, pop it in the chat box, and we'll see what we can do. If we can make something happen, we will do.
Yeah, I'll just put my email address in there as well. If you don't feel comfortable talking in the chat box where everybody is on this session, feel free to pop me an email, private email across as well. But going on from the podcast, they are really useful. You know, if you just have it playing in the back. I mean, I listen to podcasts at the weekend when I'm doing painting outside, and it's just, you might not really be listening to some bits, and we appreciate that. We know that not everyone's interested in every single bit. You know, some resources might not be useful to you at all, but some of them might really be useful, like really work with what you're looking for. So I mean, podcasts, when I'm listening to something, sometimes I just completely zone out, and then my ears prick up when they say something that I'm interested in and I'm really passionate about, and I think, oh, that's something that I'll take away from today. So whether it's our podcast is about 20 minutes at a time. Our webinar that we're doing next, so the next one following this session, will be different to this session, so it'll be going more in depth in health and wellbeing, and then we will be repeating this session in the future because we've had a couple of requests saying they couldn't attend today, so we've got another time coming up next month so we can repeat and go through these, because it's a nice chance to sort of ask questions if you don't really understand what certain things mean, and how to get in touch with people, and where do I find all this, because we appreciate working within primary care and working within the NHS. There's a whole lot of emails that you get, there's a whole lot of appointments and meetings that you get, and you do miss things. So it's just nice to sort of hear a voice sometimes and think, oh, that's available to me, and I don't have to look through my junk mail to find it. But yeah, we'll leave this slide open. Feel free to log off if you want to ask some questions. If you just want to listen in, that's fine. But we'll sort of open up to you guys if you do want to ask questions. But if not, thank you very much for attending today and listening to our voices for the past 40 minutes. And we hope you enjoy the rest of your week and hopefully get to some sunshine this weekend.